Good afternoon. Thank you for listening again today. As of 2 p.m. today, there have been 3,327 positive cases of COVID-19 in Missouri, including 58 deaths. Over 34,000 people in Missouri have been tested so far. We know that PPE continues to be one of the biggest challenges right now. There is a tremendous demand for the PPE, not just in Missouri, but across the entire country. All states are facing delays getting the product because of the high demand, but we're doing all we can to expedite the delivery of all PPE. Today, we are distributing PPE for law enforcement and fire service agencies to regional distribution points across the state of Missouri. And we will continue to do all we can to give our frontline responders the protection they need to do their job safely during this time. Today, Director Carson is here with us to give us an update on what their projects are. Director?
Thank you, Governor Parson. Good afternoon, everyone. Thanks for joining us. Today has been an especially active day for us. We've continued the screening process for the Disaster Medical Assistance Team volunteers. We have extended 139 conditional offers for folks. And we still have a need for volunteers, especially physicians, registered nurses, and nurse practitioners. So if you are interested in that, please go to the DPS website and submit your interest form and your registration. So today also, we've had more than 24,000 masks, 530 boxes of gloves, and 54,920 bottles of hand sanitizer have left the warehouse and are being distributed to law enforcement and fire service agencies across the regions of the state, according to the distribution plan. This is in addition to the 25,000 masks that were shipped on Friday to our first responders. And as I visited the warehouse this morning, a truckload with more than 1 million masks was arriving. It was a great sight to see so many pallets being wheeled out and separated by our DPS, our SEMA, our fire safety and MoDOT team members. They are working on the most efficient ways to get this PPE to our partners across the state. We have been experiencing some delays in our shipments arriving from China, and we are working with our federal partners to expedite those shipments through customs. One final note I want to touch on is severe weather is in the forecast for this afternoon and this evening in some parts of the state. I would ask that everyone pay special attention to your local forecast and take immediate action if shelter is needed. We ask that you stay safe and stay healthy. Thank you.
Thank you, Director. We know there is an increasing concern over hospital bed space, equipment, and alternative care sites. We continue to communicate with medical experts, hospitals across the state, review the data, and keep track of bed spaces and equipment. And right now, Missouri is in a good place. However, I want to assure you that we do have a plan in place. We have identified our hot spots. We are moving forward with our first alternative care facility in the St. Louis region. And Missouri Health Net Director Todd Richardson is working closely with the federal and regional healthcare partners, SEMA, DHSS, and the Missouri National Guard to help coordinate this, and we are thankful for their efforts to support Missouri's healthcare delivery system. Director Richardson's here today to give us an update on that. Todd?
Thank you, Governor. And as I've said before, one of our central missions is to do everything we can as the state to support our healthcare delivery system. We've been working not only across state government, but also with our private healthcare partners to deliver the best possible response for our state. That includes coordination with every single state department and opening regular lines of communication with our statewide and our regional healthcare providers. We continue to work through, as Director Carson mentioned, the acquisition and distribution of PPE, and the state is exploring every possible supply channel to access increased supplies for those critical needs. We're also working with Missouri manufacturers to produce those critical supplies here in Missouri. Director Dixon and the Department of Economic Development have done outreach to over 300 Missouri manufacturers to see how many of these products we can actually produce here in our state. In addition to those efforts, we're also working to directly support Missouri's healthcare system through alternative care sites. Working in close coordination with our federal and regional healthcare partners, the state is moving forward with our first alternative care facility in North St. Louis County. This model will focus on the use of hotels rather than large arena sites for care delivery. It will allow the state to move more quickly. It is a model that can be scaled as need arises, and it is a model that can be used to support care delivery across our state. This effort has been done in close coordination with the Missouri National Guard, with SEMA, with DHSS, and with support from our federal partners. We expect that first site to be operational in a little less than a week.
Thank you, Todd. The National Guard will play a major role in this process, and we're pleased to be able to get to our federal disaster declaration and funding request approved. Today, Adjutant General Compton is here to provide more details on the work mission of the Guard. General?
Thank you, Governor Parson. To my fellow citizens of Missouri, last week I spoke about our commitment to you, and I want to assure you that commitment will not change. We train, fight, and win while taking care of each other as one team. These are not hollow words. This is, in fact, our mantra. We remain focused on the health and well-being of our Missouri citizens, your Guard soldiers, airmen, and their families. As proud citizens of the Show Me State, we are prepared to show you exactly what we are doing. We are taking firm and decisive action to confront this virus. For the last several weeks, Guard members who are licensed engineers from our Forward Engineer Support Team have been working with state and federal agencies conducting numerous site assessments throughout the state to identify potential medical alternate care facilities. As we discussed before, these facilities are a contingency to offset any hospital bed shortfalls should they occur. We are working these sites in order of anticipated need as identified by the communities being supported. As the Governor mentioned, the Alternate Care Facility Working Group, which includes great teammates like the Department of Public Safety, SEMA, the Disaster Medical Assistance Team, DHSS, Office of Administration, FEMA, and USACE, to also include the Missouri State Hospital Association, and clearly in conjunction with our Governor's office. Today, our team is on site in the St. Louis area starting the pre-construction process on an existing hotel in Florissant that will provide over 100 additional beds. The construction of this facility should start this weekend and have the potential to start accepting patients as early as next week, as Mr. Richardson just mentioned. Our facilities will be converted Other facilities will be converted in St. Louis and in other communities across the state if the situation warrants. It is our hope that these facilities will not be needed, but rest assured that Missouri is ready. In addition to facilitating the conversion of these alternate care facilities, your Missouri National Guard will also help staff the Florissant facility with some of our medical professionals in conjunction with Missouri Disaster Medical Assistant Team. Your Missouri National Guard will bring medical professionals and hospital administrative specialists to this fight, while at the same time ensuring we don't pull them away from their civilian positions where they are already supporting the COVID response. As the situation here in Missouri develops, it is anticipated you will see your Missouri National Guard supporting additional missions across the state, as I've mentioned in past press conferences. Again, some of these missions will include community-based testing sites, transportation of needed equipment and medical personnel, logistical support, and other potential mission sets. We again are proud to be part of this team effort that will have a direct impact on the welfare of Missourians. We remain integrated with our state and government agencies and stand ready to bring the full force of our state resources to bear against this battle called COVID-19. Your Missouri National Guard men and women are always ready and always there. Your Guard soldiers and airmen show up well-trained, professional, and ready to work. Because of our civilian skills, we are the most diverse and talented group in the United States military. And we are bringing those talents to assist you when needed the most. Make no mistake, Missouri, we have been with you since the beginning of this fight, and we will be by your side and see this through. We will come through this stronger together. We are you. We are one team. Thank you.
General, thank you very much. Appreciate what you and the troops do every day out there for all the people of Missouri and what you do for this country, so I thank you very much. Kelly, we'll just go to questions today.
All right. Thank you, Governor. First question's for you. It's from 41 Action News, and the reporter is Sarah Plake. Will your office issue a rent or mortgage moratorium?
We have not at this point. We reached out to the Supreme Court, talked to some people over there the other day. The courts right now, it's not a priority on eviction notices across the state, so at this point we haven't taken no action. But my understanding is the court's not taking really any action at this point on that. So we'll evaluate that every day if it comes to be a problem.
Okay, great. Next question, Governor, is from Jason Hancock, Kansas City Star. Do you plan to sign the supplemental budget today or this week?
Yeah, we do plan on signing the budget, the supplemental, as soon as we can. We want to evaluate. We want to take a look at it. I don't know whether that'll be today or tomorrow, but we're going to do it as soon as possible. There's a process to go through for that. But right now, we haven't received it at this point, so we'll just go through that process.
All right, thank you. This question is from Ashley Beard, Learfield. How will stay-at-home be truly enforced, and how does DHSS have the resources to handling distancing complaints?
Yeah, it's a good question. Let me tell you how it'll be enforced. Because the people of Missouri will take the responsibility upon themselves to stay home, which they have. And they will continue to do that, and I think they're going to get better and better at that every day. That's how it would be. If you really go to the enforcement side of it, it'll have to be done on the local levels. They'll go through the courts, and they'll either go through a fine process or go through a court injunction to get that done. But I'm telling you, at the end of the day, who's going to enforce this is the people of Missouri, and they'll do it on their own. And I believe they are doing that, and there's a lot of positive things happening with that right now.
All right, great. Thank you. Governor, this is from Jeffrey Bernthal, Nexstar. How will you or do you respond to the request by the United Foods and Commercial Workers Local 655 to require grocery store shoppers to wear masks?
Well, first of all, we're not going to be mandating or requiring anybody to wear a mask. That's up to the employer and the employee to make those decisions, and then the employee would have every right to do that if they have the ability to get masks, which, I mean, a lot of people in the state of Missouri are making homemade masks or providing masks, but I think that's strictly up between them and their employer to figure out the solutions to that. I don't think that's state's place to mandate who wears a mask and who don't at this point.
All right, Governor, thank you. This question is from Aaron Hefferman from St. Louis Post-Dispatch. Today, Governor, St. Louis County Executive Sam Page has asked for increased help from the National Guard in his county. How do you plan to respond to the request, and what uses are you planning for the National Guard in the St. Louis area?
Yeah, well, first of all, I think they know the Guard's been up there. It's quite evident after today. Prior to we ever received the letter, the Guard's been up there, so they know they've been on the ground working up there. We will continue to monitor the request and see what abilities we do to help with and what they are. But one, they're going to have to streamline the request, what they want. But right now, the main thing, the Guard's been up there and been up there now for weeks prior to those letters, is finding these sites, because that right now is critical for us in the state of Missouri.
Okay. Thank you. This question, Governor, is from Claire Roth from Missouri Business Alert. She is asking, what types of COVID-19 forecasting models are you using or consulting to make your predictions, and about how the virus will impact the state?
Well, I can tell you right now, we're making our own model. I think you're seeing a lot of governors across the United States go into their own models, what's really happening in their state. There's so many models out there that are totally inaccurate. A lot of people claim to be the experts in the arena, but the numbers are not accurate at all for us in the state of Missouri, along with other states. So what most of us do, and the governors, as we normally do, we start taking care of our own states, and we don't let people in the think tank organizations that really don't have the data that we have. And again, we make our decisions every day on what's happening here in Missouri, and that's how I'm going to continue to make the decisions, not on just the models that are out there across the United States, because there's a tremendous amount of them out there, and frankly, the majority of them are inaccurate.
All right, thank you, Governor. I believe this is the last question for you today. This is from Caitlin Rosen from the Kansas City Star. She has a follow-up question from a question that you answered yesterday regarding the press. Has the governor's office been working to address some of the concerns brought forward by the Missouri Broadcasters and Missouri Press Association?
Yeah, I think the question always comes in there is a lot of the media would like to be in here at press conferences and pack the room with cameras and reporters and all that. We're doing as many as we can as time permits. We've been on numerous radio shows. We've been on TV. We're here every day trying to promote this. It may be not the ideal situation for everybody, but the really people I'm concerned about is the public. You know, making sure they understand what it is we're doing and why we're doing it. I think that's the most important to me. We're trying to make everything available that we can to the media. But the other thing I'm going to be right honest about, it comes down to safety here just as well as anywhere else. And I'm going to take care of the people in here to keep everybody safe that has to be here on a daily basis. And we're not going to jeopardize their safety simply because somebody just wants to be in a room to be able to talk to the governor. We'll provide that flexibility to talk to many reporter as we can one-on-one, and we'll continue to do that.
All right, thank you, Governor. Director Carson, I do have one question for you. This question is also from Claire Roth from the Missouri Business Alert. With the state stockpile nearly exhausted and the SNS depleted at this point, is there anything the government can offer healthcare workers who can't obtain their own PPE due to the market shortages?
Thanks. That's a very good question. And just to go back to where we were when we started this, there was two sources for PPE. One was the Strategic National Stockpile, and the other was a PPE procured through the State Disaster Fund. We continue to procure PPE through that State Disaster Fund in the absence of the SNS. And so we would ask that you would make those requests the way they were made originally through the healthcare coalitions, and that will get to SEMA and will be fulfilled if we have the supplies to do so. Thank you.
Okay, thank you. All right, Director Richardson, I have one question for you. This question is from Ray from Herman. Missouri's small rural hospitals, such as the Herman Area District hospitals here in Herman, are concerned they may have a surge in COVID-19 patients from their adjacent metropolitan areas. Can you outline the steps state government would take to help small hospitals safeguard themselves in case they become stretched to the capacity of their available beds?
I think it's a great question. And the one thing that's been true about our strategy as a state from the beginning is to recognize we've got to support the healthcare delivery system across our state, not just in our large metropolitan areas, but in our small rural areas as well. And because the virus doesn't care if you're in St. Louis or if you're in Herman. So that's why we've developed a model of supportive housing and alternative care sites that really is flexible enough to be deployed in St. Louis, but it's also flexible enough to be deployed in rural areas to support additional capacity. The last piece to that, I think, is going to be careful coordination amongst the healthcare system. And I know the Missouri Hospital Association, working closely with the state, has been working with member hospitals to make sure that that healthcare delivery system is up to the task. And I think it will be.
Okay, thank you. All right, Director Williams, I have a couple of questions for you as well. The first one is from David Lieb, AP. Although the state on Sunday began requiring coronavirus deaths to be reported within 24 hours, the state's official total released at 2 p.m. daily continues to lag significantly behind the totals posted by Johns Hopkins University, which updates its data multiple times a day. For example, Johns Hopkins was reporting 86 deaths in Missouri as of this morning, while the state's website still listed the number of deaths at 53. The result is that state's figures don't appear to be reflecting the full impact of the virus. Has the state considered updating the data more frequently, or is the state doing anything to try to ensure that the figures it distributes are more reflective of the current situation?
David, thanks for the question, and we have looked into that. I think the short answer is, as the Johns Hopkins website disclaimer says, we're required to be official by law. So we have to vet those to make sure, because those are the official numbers that we give to the CDC and others, just like we do birth certificates and death certificates. And Johns Hopkins, while we greatly appreciate our academic partners, is pulling from multiple sources. We originally went to twice a day, but found that that was confusing because the numbers come in all the time from our commercial labs. And we also get, even though last Saturday we mandated that deaths would be reported within 24 hours, we get those at different times of the day. So we feel that our policy of putting it out at 2 o'clock, all of our information at one time, has been well received by the media and the public. And at this point, we can plan to continue to do that. Thank you, though, for your question.
All right, Dr. Williams, this is from Summer Ballantyne, AP also. Why is the state not requiring race to be reported in coronavirus positive cases and death?
Summer, we do mandate that, and about 40% of people are not doing what we require to do. So we sent out a directive today to reinforce that we do want that demographic because we think it's really important. I've been on the phone today with health directors, Rex Archer in Kansas City and Fred Eccles in St. Louis City and other places, and we are following that data from around the country that the morbidity and mortality in minorities is higher. And as I said yesterday, it is our job to make that better. So we think the first way to do that is to get good data. So we're going to reinforce that that is required by law. And second of all, in my talk with health directors around the state today, we're very much going to focus our testing. And we have a way of doing that we're going to roll out. And that's what my conversations with the health directors were. And then the final thing is that we just very much have to concentrate our message in all communities on social distancing.
All right, thank you, Dr. Williams. This question is from Caitlin Schallhorn from Missouri Times. In some areas around the country, local health directors are encouraging people to consider pulling family members out of nursing homes, especially if they only require minimal assistance and people are working from home to cut back on the spread of the coronavirus. Is this something, Dr. Williams, that you would like to see happen?
Caitlin, my 90-year-old mother is in a long-term care facility. And I think as long as those long-term care facilities are practicing not having visitation, good social distancing, my answer would be I would not. We very much appreciate the efforts they've taken. We greatly appreciate the frontline workers in those long-term care facilities taking care of patients, just like our other first responders or our frontline people. So I would not at this time. Thank you.
Okay, I have one last question for you, Dr. Williams. This is from John O'Sullivan, KMOV. I think you've answered this before, but just one more time for clarity. Also, will the state start reporting the number of recovered COVID-19 patients as other states are doing?
We've asked that of the Missouri Hospital Association if we can track that data. At this time, they don't feel that have the opportunity to do that. We're looking at that. As I've said before, based on the data you referenced, we think that number is about 80% of patients who go in who get oxygen, who come out. But we'll continue to look at that. I think it's important to know. And so thank you for the question, and we'll continue to see if there are ways that we, in aggregate, from all of our hospitals, about 150 report, can capture that data. I think it's important to know, and I think it's important to reinforce that many people get better. Thank you.
All right, thank you. All right, I have one last question. General Compton? This is from Lucas Geisler from ABC 17. You alluded to this a little bit in your statement, but just to clarify, has the Guard been mobilized to actively set up any of the previously announced sites for alternative health care facilities? And also, have any of the previously announced sites been ruled out?
Hey, thanks for the question, Lucas. And yes, I did mention it in the narrative, but to double down, we have been mobilized clearly by the governor, and I mentioned in this statement that we were in St. Louis today working with a number of teammates, USACE, the Missouri Hospital Association, to work on standing up an alternate care facility there in St. Louis. So we're doing that, right? We're getting after the ACF requirement. And the other part of the question is no. I don't think any of the sites are off the table. The important thing is we just want to stay ahead of the curve, working in conjunction with the alternate care facility and the bunch of great teammates. And I can't overemphasize the importance of the Missouri Hospital Association and the healthcare workers out there on the front lines, helping keep the hospitals at a low enough capacity to deal with the COVID situation. So thank you.
Okay, thank you. All right, Governor.
Let me just add to this. I've said this numerous times before, but everything changes every day. So we get the direct questions that are asked of the general today, and all the other speakers have been up here. All these things change rapidly every day, and every day we make adjustments. And just like the site facilities we've been looking at for weeks now, trying to figure out what is the best place for those sites to be and how do we determine where they go and what are the hot spots and how we do that. So everybody's been working on that extremely hard every day. The other thing before I go to closing remarks today, I want to take a little bit of time to thank the legislators, the staff, and all the people it takes to come into the Capitol to perform their duties, all the people that have to come in to go to work. I want to thank them for coming in, doing their part. It was very significant what they did, getting a supplemental budget done for the state of Missouri. That's $5.8 billion worth that's going to be coming to the state that we got to be able to distribute to hospitals, to small communities, to everyone across the state that's been directly impacted by COVID-19. So I want to thank them for doing their part to be in here, making the process as smooth as they can to help us move forward in the state to fight this battle. There is no doubt that these are hard times. Some of the hardest Missouri has ever faced. But I want Missourians to know that there is hope, and there are still positive things happening all around us. Missourians from across the state have stepped up to help, from the private sector to everyday citizens. There are a lot of people doing the right thing, whether volunteering their time and resources or by simply staying at home. Social distancing is working, and people are recovering. This is what's going to take to overcome this. Missourians working together, looking out for each other and doing their part. We aren't out of the woods by any means, but we will overcome this. So please continue to be smart, be responsible, and stay home, Missouri. Thank you very much, and God bless.